Well, good morning. I'll be present here. This is Ashish Kumar Singh in front of you all, going to express you about the external applications. Coming to the topic list, we will tell about the organelles view related to the external applications, whether we should use or whether we should not use. Some external applications like poultices, fermentation, surgical gauze, oils, and injections. So, in view of the Honeyman, we will tell about the fifth edition. He discouraged about the use of the external application, and he told about that in the Apophism 196 to 203. On the other hand, in sixth edition of the Organon, he however encouraged about the use of the external applications from Apophism 284 to 85. Now, we will deal with it in detail that in edition 5th of the Organon, Hahnemann told about that we should not use the external applications by expressing few of the possibilities. That first possibility would be expressed in Apophism 196 and 97 that we should use the external applications. Both we should use the drug which is to be applicable internally should be used externally also. That is, we should use both externally and internally the same remedy which is to be given to the patient. So here he commented about that if we will use the remedy both externally and internally, the external symptoms would go away more far than the internal diseases, and we will not be able to get the root cause of the disease, and we will think that the external symptoms have gone, so the internal disease might have gone. So we will be uncertain to know about that whether the actual cure has occurred or not. In the Apophism 198, he told about that we should use the external applications purely externally. The remedy which should be given inside should not be given internally, should be used externally only. So here also he commented that the external application of the remedy would cause the skin eruptions which were there due to some internal cause would go away, but the actual cure would not be happening because the disease is actually due to the derangement of the vital force which is inside our body and which is dynamic, and the disease will again come back. So it would be a suppression rather than a cure. Coming to the 199 Apophism, there is a possibility that we should surgically or any drying agent should be used externally. After that we should use medicine which is to be applied. So here also he commented that the actual signs and symptoms are due to the external appearance only, and we will remove those, then it will further cause more problem to the internal organs rather than the actual cure, and it would be a not good idea to use it. In the Apophism 200, he told about that if we use any internal medicine, suppose we should use any internal medicine given internally, and we are not using any of the external application for that, and the disease is cured, so it will give a firm proof that the disease was actually due to internal derangement of the vital force rather than the actual superficial seeing what we are seeing from the outside, that the skin eruptions were there, some condition were there. That was not due to external causes but due to the internal diseases which were developing inside the body. Coming to the next step of Apophism 201, local symptoms enlarged by vital force lessens internal diseases. So here it has been told that the vital force tries to what we say, protect the more vital organs by throwing out the disease to the less important organ. So if we try to remove those external symptoms by external applications which were due to the adaptation of the vital force, we get we are reversing the process of the disease, and the skin eruptions, the external symptoms would be gone, but the more vital organs would be destroyed in the help of that thing. Coming to the next apophism 202, when local malady is removed by external application, so the internal malady arises which had earlier coexisted with the affection. So both the internal and the external diseases were due to the main cause of the external symptoms were due to the disease, but we have done a good job by destroying those symptoms. So the whole disease is on the vital organs, so the vital organs would be destroyed with more rate rather than it was before. So we have destroyed our body by using the external applications rather than giving it a help. Apophism 203, it has been told that nature is a best thing. So nature tries to protect the more vital organs by throwing out the disease to the less important organs. But what we do, external applications alters the nature's work. So nature's work is destroyed by the external applications. By suppressing those external symptoms, we have given a more harsh treatment to our body which is inside. So for those cases only, Hahnemann have said that we should not use the external applications, because coming to the crux, the external symptoms are due to the vital force derangement which it is crying for the mercy. And what we are doing, we are just suppressing those symptoms, those signs and symptoms we are suppressing rather than the actual cure. So due to those reasons only, Hahnemann said in 5th edition that we should not use external applications. Now coming to the next, in favor of the external applications, Hahnemann in 6th edition have told in the apophism 284 and 85. So in 284 he told about that the skin is also a good route of administration of the drugs. So we should use those drugs not in the affected areas. Make my point clear that we should not use the drug on the affected areas like skin eruptions or the spasmodic area where the problem is actually there. We should use those things as on back, arms, extremities, by rubbing. We should use those as a route of administration. We should use the drugs, we should use the skin, which is told in the apophism 284 and 285. It is being told that we should avoid the area of the affections. We should use it on the back, arms, extremities by rubbing. We should not use on the affected areas. Coming to the next, in 282 apophism, it has been told in the footnote of the 282 that in case of the figure that existed for some time without treatment, we should use the same medicine administered both externally and internally at the same time. So in the apophism it has been told, you can all read. Coming to the next, only in one case of the thing, Hahnemann have said that we should use the external applications. In case of the invertebrates and difficult cases of the psychosis, we should use the thusa externally. Rather, in all the cases we have discouraged the use of the external applications. Now coming to the external applications, firstly we will deal with the poultices. You all can read about their characteristics, and the most important thing is that it draws out the infective material from affected part due to its two properties, that are hygroscopic and absorptive characteristics of its ingredients. You all can read it. So coming to the types of, there are three types of the poultices. One is linseed meal poultices, bread poultices, and charcoal poultices, and carrot poultices. So you can all see it properly that in linseed it is just about it is used for the advantage of using it. It gives the warmth to the affected area for a long period of time. Bit liable to irritate. It can irritate the skin and delicate skin. So disadvantages are that it can irritate the liable and delicate skin, and in some cases we have seen the intolerance have been seen in some cases, and causes the fatal attacks of the asthma. On the right side of the screen you all can see how we should use it. There is nothing too more problematic that we should use it. Boiling water should be poured over a heated bowl. Now the meal is used in it, and we should regularly stir it so that it should not be hard material. It should not become, and we should make it in a form of the paste and spread that paste on the muslin cloth, and the desired drug which we want to use, we should use on that muslin cloth, and after that we should fold it and use on the affected area. Coming to the next type of the poultices, that is bread poultices. It is useful for its non-irritating and bland properties. Coming to its procedure, how we should use, there is nothing more problem, as I have told that boiling water should be poured over the slices of the bread. Now those breads are placed near fire for a few minutes. Then pour off that water which was earlier poured on that bread, and a fresh boiling water should be poured, and it should be beaten until it becomes the form of bread. It becomes into a form of poultices. Coming to the next type of the poultices, that is charcoal poultices. It is best type of poultices. It corrects offensive smell which is coming from the body from foul sores and favor a healthier action. Now coming to how to use it, simply mix the charcoal with bread poultices, or just before application sprinkle the surface of the charcoal layer, and the simple bread poultices should be used on that affected area. Now coming to the next type of the poultices, that is carrot poultices. It is used as a wound cleaner for the healthier action. Boiled carrot becomes soft, then it is mashed into paste and applied. The uses of the poultices are there. On the right side of the screen you all can see it. Now coming to the next, fermentation. So there are three types of the fermentations. Coming to it, first is the hot fermentation. Actually fermentation we all have used. If we got any type of injury, internal injury to the bone or to the muscle, we all have used that fermentation in different forms, but we have used. Now coming to the hot fermentation, its uses are they help in soothing pain, arresting inflammation, and checking the formation of the pus. When applied over bowels, acne, etc., they reduce the size of that thing. Now poultices also help in expulsion of the pus. Along with the poultices, these hot fermentation actually can be used in a better way. Now how to use it? As I have told, all have used it. If someone have got some muscle strain or some type of condition, they all have used. So take a cloth, simple cloth, take the 2 folds of the fennel large enough to be covered affected area. Now soak this cloth to the boiling hot water or pour the water on it. Either thing you can do. Now squeeze the hot water from the cloth and apply on the affected area. We all have used. Coming to the dry fermentation, these are used where relaxation of the tissue is to be needed, avoided with the moisture, which we use that dry fermentation there. Coming to that cold fermentation, it is applied to the lessen the heat of the body surface either by cold water or ice bag. It works on the principle of the evaporation. Make a point that it works on the principle of evaporation. Wet a sterilized clean folded cloth in cold purified water. Leave it uncovered to permit evaporation and apply it to the affected part. How to use? We have to. Bleeding is stopped sometimes by applying cold by ice. Directly ice which we use on the bleeding area. So due to the constriction of those muscles, those blood vessels, the bleeding stops. Now coming to the next type of the fermentation, that is ice bag. It is a subtype of the cold applications only. So ice bags can be put on the head in meningitis or in contusion or on the knee joint for inflammatory conditions. So uses I have told. Procedure, the similar type of the procedure is there. Pack ice into small pieces and fill up 3/4 part of the rubber bag. We, as a common person, we used to have that ice cubes in a cloth and we directly use it. So it is more technical to tell. So they have told about that break the ice into small pieces and fill up 3/4 part of the rubber bag. And those rubber bag is pressed to expel the air remaining in the bag. Now tightly close the mouth of the bag and use on the affected area. Coming to next type, those are oils. Oils are actually more prominently used in the case of the Ayurveda. Here also we use for the massages, but most prominently it is used in the Ayurveda. Medicated oils are made by steeping for sometimes the requisite medicinal substance in different oils like olive oil, almond oil, rosemary, etc. So coming to the first type of the oil, that is Bauchi oil. Its source is Sorella carylifolia. We used to say Bauchi in Hindi. Its seeds are used for the preparation of the Bauchi oil. Make it clear here only about the sources and preparation and the uses of all the oils. So be careful while dealing with it. So I have told the source. Now preparation is crush seeds to a fineness of 20 meshes. So the ground seeds in sesame or tail oil, 1 part of the seed soaked in 2 parts of the oil. Keep like this for 10 days, occasionally stir it. At the end of the 10 days, strain the solution and adjust the strength accordingly. Now coming to the next type of the oil. Now coming to the uses of those oils. Shows marked change in cases of the depigmentation of the skin. It is also used in case of psoriasis, boils, tubercles, liver spots and all other cases of the dirty looking skin. and in the leukoderma. So coming to the next type of the oil, that is mullein oil. Its source is Verbascum thapsus, and the flower extract is actually used for it. So coming to next, its uses are, it is mainly used in otic conditions for the ear conditions related to the ear problems. Mullein oil is mainly used, so those symptoms are only there, used mainly in the otic conditions like otalgia, otitis, otorrhea, etc. It is recommended in the formation of the scales in ear as it is bactericidal, so it kills the bacteria, so it is used as antibacterial in the case of the scales in the ear. It softens and thereby facilitates removal of hardened wax from the ear. So those who cannot hear my words properly, they should use mullein oil in a better way. So it is a one type of medicine also. It also relieves pain in the ear. So for all the cases of the ear, you can use mullein oil. Coming to the oil of the wintergreen, its source is Gaultheria fragmentissima. It is produced from the distillation of the fresh plant, and its uses are, it relieves the pain in gout, rheumatism and sciatica. It is applied over the scrotum in the epididymitis. The third use, it reduces the pruritus. Coming to next type, olive oil. So its use is prepared from the ripe fruit of Olea europaea. Its uses are, it is used topically as emollient in dentistry as a setting retardant for dental cements, and it is used as a purgative when given internally. So if we give it internally, it will work as a purgative. Now coming to the next type of the oil, that is arnica oil. So sources is the dry root of the arnica are coarsely pulverized. So it is produced by the roots of the arnica. Those are dried and coarsely pulverized. Now preparation, how to prepare that arnica oil. 1 part of the coarse powder is added with the 9 parts of the olive oil, kept in well stoppered bottle for 2 weeks, warm room. After that, content expressed and filtered. So its uses are, everyone knows, arnica oil is very much useful in the hair oil. It is used as a hair oil and also used over bruises. Now coming to the rosemary oil, its source is, it is produced from the small fragments shrub, that is shrub Rosmarinus officinalis, prepared by steam distillation of fresh flowering plant. Uses is, it is used in perfumes and cosmetics. It is medicinally inert. So for coming to the use of the rosemary, from rose you can take the idea that it is used for the case of the cosmetics and perfumes, not for the medicinal property. So medicinally it is inert. Coming to the next type of the external application, that is injections. So there are 2 types of the injections we used to use. Those are vaginal injections and rectal injections. So in vaginal injections, you should keep mind that there is a use of the formula for the use, that is Ludelam formula. 15 ml of the mother tincture, what the drug we want to use, should be added with the 45 ml of 1%, 1.5 ounce, that is glycerine, of glycerine, and 60 ml of the distilled water. Coming to the conversion of the ounce, 1 ounce is equals to the 30 ml. That is, you can calculate it properly that 15 ml of the mother tincture should be used along with the 45 ml of the glycerine and the 60 ml of the distilled water. This is called as the Ludlam formula. Now coming to the rectal injections, the prescribed amount of the drug is mixed with around 60 ml arrowroot water or thin starch solution. It is injected slowly so that it may be retained. Now coming to the next type of the external application, that is surgical dressing. Subtype of it is, first is cotton. So there are two types of cottons actually. First is absorbent cotton and the other is non-absorbent cotton. So absorbent cotton is nothing but the natural wax and other impurities are removed, so it becomes the absorbing. That's it. That's the only difference between the non-absorbent and the absorbent cotton. So absorbent cotton is used for the application of the local medications. So any drug, any external medicine which is to be used on the body should be used on those absorbent cotton, and that cotton should be used on the body where it is needed. And it is used as the application of antiseptics and cleaning the skin before parenteral introduction. Now coming to the other type of the cotton, that is non-absorbent cotton. So as I have earlier told that the only difference is that natural wax is not removed from this type of the cotton, which is non-absorbent cotton, hence making it water repellent. So its use would be where we don't want to avoid the water, we use this type of the cotton. Useful for packaging, giving cushioning effect to the bandages over the wound. We have to avoid the water there, so water should not reach the affected area. So there we use it like that. Now coming to the next type, that is surgical gouge. There actually, what is the use of the gouge? We are telling that gouge gives tensile strength while maintaining the absorbent quality of the material. The cotton is woven in open mesh cloth. Now gauge pad and the cotton filmated gauge, sanitary napkins, absorbent lints. These are the types of the surgical gauges. First is gauge pad. Here you have to make sure that there are two sizes are coming, that is 2 into 2 to 12, 3 into 2 to 12, and 4 into 4 to 8 and 16 plies. So this gauge pad is used over the cutting it into various sizes, taking care that no loose threads are left behind. You all can read it about the gauge pads. Cotton filmated gauges, these are more economically thin absorbent cotton is used in this cotton filmated gauge. The folds of these gauge and then folded. That's it. Now coming to the sanitary napkins, it is a very helpful thing. You all might know that they are used in gynecological and maternity cases. The presence of the foiler of the absorbent cotton cellulose makes them better for absorption and drainage. Make sure that should keep on eye that the foiler of the absorbent cotton, that is cellulose, is actually used for the absorbing property of the sanitary napkin. Now coming to the absorbent lint, it has a cotton fiber jetting out and woven cotton over one another. So the absorbent is used for applying ointment plasters, gives support and protection to the wounds. Now coming to the next type of external application, that is bandages. There are actually five types of the bandages, that are common gauze, roller bandages, electrocrate bandages, adhesive bandages, plaster of Paris bandages, and bandages impregnated. You all can read about those things. They are the most commonly used bandages, that is common gauze roller bandages. We all have used these type of bandages. In the case of any stress to the muscle, if we used to use these bandages. Now electrocrate bandages, they provide greater compression and support because of their elasticity, and they are elastic but have no rubber. The elastic property is due to the woven characteristic of that bandage. Due to that, it is giving the elastic property. Now coming to the next type of the bandage, that is adhesive bandage. Its use is commonly used when more support is required, as in fracture of a rib, when muscles and ligaments are involved. The next type of the plaster of Paris bandages. We all know about its uses. These are used in fractures and dislocation where immobility is required. Now preservation, it is kept in waterproof packaging as moisture tends to harden the plaster, making it useless. So coming to the last, that is mother tinctures for external users. In each of the cases, it have been told that how to make the external applications, but if it is not being told, so we should use in this general base, that is for formula for class 1 and 2, we should use 1 part of the mother tincture with 1.5 part of the ethyl alcohol, that is 45% pure. Now for the class 3rd, 1.5 part of mother tincture is added with the 1 part of the ethyl alcohol. Now coming to the 4th class, if there is no, as I have told that if there is no special direction for the preparation of any drug substance, we should use 1 part of the mother tincture with 1 part of the ethyl alcohol in case of the class 4. All these are taken as a part in weight. All medicines must be labeled as external applications. It is most important to use the labeling wherever and whenever needed. Now coming to the session of the questions, because without questions it is not good to leave the topic. So you should think of those topics in your own mind. I would ask some questions about you. What is Ludman Forman? Other question is about the use of the rosemary oil. Next question is about the olive oil uses and its source. And tell me about the aphorisms in which Honeyman have discouraged about the use of the external applications. And tell me one that special case in which he advocated to use the external application. Which type of the politician is not good, and should not be used because it can create fatal attacks of the asthma. These are only you should think about their answers and write in the comment section. If any doubt is there, please ask in the comment section. Thank you.